Recognize the bill author, the member from Washington County, Representative Dean, to introduce your bill.
Thank you, Mr. Speaker and members. This is the Health and Human Services Finance Bill portion today. Also going to be hearing from Chair Torkelson from the Transportation Division, and also looking forward to that. And we are going to be talking a little bit today about health and human services within DHS and Department of Health. Some areas that we're going to be covering today. There's three major portions of this bill that I think are very important to talk about. One is the DWRS, or the 7%, for members that have been looking through their email boxes the last few weeks. The CMS has basically cut 7% from some of the hardest working, biggest hearted people in the state of Minnesota who don't get paid a lot, who work out in the community taking care of vulnerable folks around the state. This will restore that cut that was given to us at the federal level. And for that, I would like to yield to Representative Schumacher to talk a little bit about the DWRS funding that is in the bill, if he would yield.
He will yield. The member from Rock, Representative Schumacher.
Thank you, Mr. Speaker and Chair Dean. I wanted to talk a little bit today about one of the three main priorities that Chair Dean and the committee had put together this year, reinstating the 7% rate adjustment for our DWRS, or the Disability Waiver Rate System. In 2013, the legislature appropriated a 1% increase to our waivered systems. The legislature followed that up with a 5% increase in 2014 and a 1% quality add-on in 2015. That's where we get that 7% number that we've been hearing about all session long. The 7% has been a much-needed addition to the rates for all of those waivered services, including elderly waiver, DWRS, PCA services, and home and community-based services. While the rates go to the consumer of services, the legislative intent and the end result were higher wages for those direct workers who are working on those waivered services. But earlier this year, we learned from the Center for Medicare and Medicaid Services that the 7% did not meet with federal compliance because, according to our own DHS, the cost of living increases enacted in 2013 and 2014 were duplicative of the inflationary adjustments within the DWRS formulas. The DWRS system, when implemented, had two main components. The problem we had before was that there was county rates all throughout the state, so we had 87 different rates, and we were told we needed to go to a single statewide rate, and there were two main components that went along with that. First, as a way to soften the impact for those high local rates who would be lowered by statewide rates, the state initiated banded rates to gradually bring consumers to the new rate system. We are currently in year 5 of a 6-year banding adjustment with a possible 7th year in the works. The second component of DWRS system implementation is the inflationary adjustment. Current law established a mechanism to automatically adjust rates every 5 years to inflation. That's where today's rub comes in and why we need to pass the HHS bill in front of us. We can and have argued over the last biennium that the 1%, 5%, 1% were not cost of living adjustments, but rather a simple increase in the rates. Based on that information that CMS received, though, they were not convinced. Since the argument of legislative intent went nowhere, Chair Dean's HHS Omnibus bill establishes a competitive workforce factor, which ensures that the dollars from the 7% would be in a different category and would not be considered cost of living. The competitive workforce factor is a framework based on analysis that shows that the wages of direct support professionals lag behind others in similar training and education. The factor values in this legislation is 8.35%, which makes the consumers under the disability waiver rate system whole with what the legislature intended in 2013, 2014, 2015, and 2017. Chair Dean's bill removes the CMS concern that these rates are stacked up and, upon CMS approval, would reinstitute the federal match on the dollars from the 7%, ensuring that what consumers expected in their rates are actually there. And to the well-intentioned questions about how this rate works with the 5% campaign or encumbrance, the funds to ensure that they go to the workers, first, it's worth pointing out that this is money that the consumers already had prepared for in their rates because twice now the legislature has appropriated the funds. This is not new money. This is money that had already been spent. Under this bill, the base wage index will be applied through the Department of Labor and Industry, as it already does, and as it does for all other waivered systems. Then, for DWRS and day services, the competitive workforce factor will be applied to that base wage index before the formula components, such as transportation and training, are taken into effect. When we do something like the 5% campaign, that's an overall increase to the base wage index and all the formula components. That's why a 7% campaign becomes an 8.3% competitive workforce factor. In addition, the new bill reporting requirements under this bill will provide for better information for future legislatures to compare wage and benefit trends from year to year. And the new approach to the formula will allow future lawmakers to pinpoint and identify particular formula components, such as the transportation or training. And as one more point of clarification for members, when we're considering which consumers are impacted by this, the DWRS system is the one that works with the non-medical needs. This isn't the PCAs, this isn't elderly waiver, this is habilitative and job services for those in the disability community. Beyond the rate change to make consumers whole, Chair Dean's bill also includes employee wage, benefit, and other data to be reported. It also alters the inflationary adjustments for DWRS services to go from every 5 years to every 2 years, which will help in budgeting at the Capitol and with the clients. Thank you again, Chair Dean, for including this provision in your bill and making consumers with disability services whole.
Representative Dean.
Well, thank you, Representative Schumacher. There will be a test on the DWRS rate system and how that will be impacted. So thank you for explaining that, Representative Schumacher. The next piece that I would like to go through is Representative Keel, who's going to be talking about the vulnerable adult portions of this bill, another big priority for members this session for representing vulnerable Minnesotans across the state. So if Representative Keel would yield and describe that portion of the bill.
She will yield. The member from Polk, Representative Keel.
Thank you, Mr. Chair and Chair Dean. Members, my co-authors and I are pleased to bring you a comprehensive plan to address the Minnesotans' concern regarding the vulnerable adult abuse. I say comprehensive because ours is a plan that incorporates input from all stakeholders, consumers, and providers. Members, this bill grew stronger every step of the way because we continued to engage and incorporate input from all sides. Ours is also a plan that addresses all elements of the Office of Legislative Auditor's recommendations, which were issued in response to the state's mishandling of horror stories of abuse we all heard about last year. Ours is a plan that will identify and stop abuse most quickly. We will do that through funding for a new electronic case management system that will reduce the average investigation time. We absolutely must do better than 140 days it currently takes to investigate a complaint, far more than 60 days required by law. Failure to fund this new system condemns our vulnerable adults to experience abuse and languish in that abuse. Ours is a plan that affirms, preserves, and expands the individual rights of our vulnerable adults. Our bill asserts and enhances patient civil rights in 10 different instances, including affirming that every patient's right to civil and religious liberties, including the right to independent personal decisions and knowledge of available choices, cannot be infringed, that the facility must have responsibility to encourage and assist in the fullest possible exercise of these rights. Giving patients and residents to the right to notification about the status of a filed report, its disposition, and their appeal rights. And reinforcing the providers cannot retaliate against the rights listed in the applicable Bill of Patients' Rights. Ours is a plan to hold bad actors' feet to the fire. It defines and outlaws deceptive marketing practices. It frees the commissioners of health to issue corrective orders and fines more freely. Additionally, It requires it requires additional home care surveys. It requires providers to create and be held accountable to corrective action plans in response to corrective orders. It expands civil penalties. It removes the burden of having to prove demonstrable bodily harm in assault cases. And finally, it requires the posting of every substantiated report of maltreatment on the improved OHFC website. Members, the overwhelming majority of Minnesota vulnerable adults receive first-rate, compassionate care. But unfortunately, as we all know, that is not the case for all of our most vulnerable. That is why this is a bill that our vulnerable adults have been waiting for. Members, you, like I, if you are like I and are unnerved by the reports of abuse among vulnerable adult populations, and you want to identify it promptly and end it quickly, this is the bill you've been waiting for. Members, if you want to ensure that when you and your loved ones come of age, that your rights and decisions making are respected, this is the bill you've been waiting for. And members, if you want to punish the bad actors without making it harder and more expensive to deliver care, this is the bill you've been waiting for. Members, I urge you to support House File 3138, and I thank Chair Dean for putting this in the bill.
The member from Washington, Representative Dean.
Well, thank you, Representative Keel, and thank you to all of the members who served on that committee to try to address some of the vulnerable adult reporting issues. Members on both sides of the aisle who contributed to that, and to all of the folks in the agencies and around the state who really stepped up to provide a lot of testimony and ideas that we can implement very, very quickly to address this issue. And as Representative Keel said, the vast, vast majority of Minnesotans are receiving great care in great places from really gold-hearted folks around the state. But we do want to address this issue, and we have in this bill. The third issue that the bill deals with is the opioid crisis. And we've dealt with that within this bill in about 7 different ways, really dealing from the opioid crisis from the earliest point, from trying to talk to kids before they even think about this stuff in our schools with the state health improvement to limit opioid harm. That bill actually is Representative Lunen's constituents reached out to him and said, what can we be doing in the schools to really talk to kids about opioids in this crisis, to try to keep kids off of this terrible, terrible track. So Representative Lunen's constituents brought this forward. This was worked on to try to get education into the schools for our youngest Minnesotans to try to prevent something bad from happening. Also in prescription and looking at how to deal with prescribing. Also, we're dealing with our opioid reduction project, really dealing with Narcan and at the end. So really from pre-addiction, even before something's prescribed, to when it's prescribed, to how we're dealing with addicted folks, to Narcan when they overdose, a real full gamut of really trying to tackle this awful, evil crisis that's gripping Minnesota and around the country. So those are some of the issues that we've tackled on, and we'll address that, I'm sure, in the debate. Also, we have welfare training improvement programs within the bill. Representative Fenton's provision for crisis and suicide hotline, which is also addressed in this bill. Those are some of the high points and priorities that we have within this bill. We also deal with that are not in this bill that you might be wondering, hey, where is this? The School Link mental health grants are not included in this bill. They're in Representative Loon's bill and the education bill that we voted on a few days ago. And that's where that is carried. $5 million is carried within the education bill this time. So we do appreciate that and appreciate the work that the Education Committee put forward on that. And with that, members, I think we'll go to amendments and questions on the bill.